So let's take a look at response to injury. The length and duration of each of the stages that we're going to walk through is dependent upon the amount of energy imparted within the fracture. The response being proportional to the amount of tissue that is being disrupted and the total amount of reorganization that must take place to reconstitute first the bony matrix and then the Herbacean system. So we have injury that occurs. This injury initiates the fracture. The fracture is followed by formation of a hematoma. This hematoma leads to the accumulation of blood within the area and initiates the initial repair via intramembranous growth response. This intramembranous growth response is due to a trigger of fibroblast and osteoblast activity accompanying the inflammatory response to remove the debris following fracture. The initial response within the fibroblasts and the osteoblasts is to develop a haphazard woven matrix. This haphazard woven matrix is patterned in an attempt to anchor the areas of bone fracture together, forming what is commonly referred to as a bone plug or bone callus. This leads to subsequent remodeling within the bone matrix, very similar to the remodeling during turnover of the Herbacean system. This develops a cortical region of concentric ringed lamina and a trabecular region of increased spindles and spikes. It forms a plate of bone that surrounds the initial hematoma and area of fracture. This growth is within the local region of the bone and is specific to the amount of trauma that occurred to initiate the response in the first place, as opposed to the general appositional growth that occurs during bone growth. The end result is a repaired and reorganized bone matrix. In some cases, this can be seen with the development of bony landmarks and attachment points, or due to trauma and the resultant response to a fracture. The length of time that results is always dependent upon the amount of energy that caused the fracture in the first place.